Hello everyone. So today we are going to start the discussion of few MCQs from microbiology. The first question is, which of the following best describes the characteristic of gram-positive cocci in cluster, which is which is catalase positive and oxidase negative, resistant to bacitracin. Now this description is quite relevant to Staphylococcus. Okay, and this gives a bunch of grapes appearance. Tetrad appearance is seen with Micrococcus. It is seen with Micrococcus. So the answer to this question will be option A, bunch of grapes appearance, and glucose utilization, it is fermentative, never oxidative, because Staphylococcus is a facultative anaerobe. It is not an oxidase positive organism, so the glucose utilization won't be oxidative. The next question, which toxin is responsible for causing staphylococcal scalded skin syndrome? Answer to this question will be exfoliative toxin or epidermolytic toxin. Because of the epidermolysis, there will be scalded skin syndrome. Okay, remember this one, Pantene Valentine leukocidin toxin, PVL toxin, is what is dermonecrotic. It is what is dermonecrotic. Okay, and it is leucocidal. It is leucocidal. Okay, these are dermonecrotic and leucocidal, and very important, these are also grouped under synergohymenotropic toxin. Synergohymenotropic toxin, because these are bicomponent toxin. These are bicomponent toxins. Okay, enterotoxin of the Staph aureus is something which is causing food poisoning, and this kind of food poisoning that you need to remember is having a short incubation period of around 6 to 8 hours after consumption of meat or milk products. Generally they will give history of taking pastries in a party, birthday party, and in morning there will be emesis, diarrhea, okay, vomiting. These things will be there. So because of the vagomimetic effect of this enterotoxin, there will be food poisoning following meat or milk product. That is very important. Next is alpha hemolysin. Remember, this is something which is showing paradoxical reactivation. And this paradoxical reactivation happens at around 80 to 100 degree centigrade temperature. Okay, at around 70 degree it is inactivated. Okay, and after that 80 to 100 may it again reactivate. This alpha hemolysin is important. Beta hemolysin is which is going to show something which is known as hot cold phenomena. Next, they are just asking about the clinical feature of toxic shock syndrome, which is caused by toxic shock syndrome, toxin 1 of Staphylococcus. And the answer to this question will be fever, yes, hypotension, yes, maculopapular rash, serum creatinine level will be increased. Okay, mucous membrane hyperemia will be important finding, and there will be coagulopathy. This option just you need to remember. Next question, they are asking that a newly married female who presents with UTI, a newly married female who presented with UTI. So the most common organism is Staphylococcus saprophyticus. Remember Staphylococcus saprophyticus, which is causing honeymoon cystitis. Okay, which is causing honeymoon cystitis, and it is a coagulase negative Staphylococcus. Only Staph aureus is coagulase positive, rest all are coagulase negative, and it is most common cause of honeymoon cystitis or your UTI in newly married female. That is very, very important. Staphylococcus saprophyticus is novovirusin resistant. It is novovirusin resistant. Okay, novovirusin sensitive strain is your sensitive one is Staphylococcus epidermidis. Okay, the same question asked in a different way. Now the next question they are asking that patient visited dermatology outpatient with pus filled boils. Okay, so there is also pain and fever. Now culture shows Staph aureus. That is important. What other infection can be caused by this? Okay, remember erythrasma is a corynebacterium disease. Okay, chancroid is Haemophilus dicroi, acne vulgaris is propionibacterium or cutibacterium. So bullous impetigo will be the answer. Bullous impetigo, remember bullous impetigo, the impetigo, bullous impetigo, cellulitis, furuncle, folliculitis. Okay, these are all the most common cause of this is Staphylococcus aureus. Okay, then which of the following organism is most likely responsible for CNS shunt infection? The answer to this question will be obviously epidermidis, which is novovirusin sensitive, and as I told you, it is most common cause of bacteremia in CNS shunt infection, IV cannulated patients. And next question is around this one again, presented with a skin infection in the arm and characterized by redness, warmth, swelling. Now what happens, this is H2O2 added and bubble formed. That means it's a catalase positive. Okay, so the cattle is positive and a skin infection, superficial skin infection. So probably this is a Staphylococcus aureus. Okay, because Streptococcus is going to be catalase negative and this is not Clostridium tetani outpresence. Next question, which of the following organisms known for exhibiting partial hemolysis on blood agar with a greenish color obviously and optocin sensitivity and bile solubility is consistent. So they are asking about a strep which is alpha hemolytic and alpha hemolysis is shown by viridans group or non-viridans, that is pneumococci, non-viridans, that is pneumococci. Okay, so the answer to this question will be no doubt streptococcus pneumoniae. Okay, viridans will show no hemolysis or gamma hemolysis, and pygens which is a beta hemolytic group A streptococcus, this is also not going to be the answer. Now these two show your alpha hemolysis or partial hemolysis and produce greenish color on blood agar, but here they have mentioned optocin sensitive and bile solubility positive. That means this is pneumococci because viridans are optocin resistant. Okay, and they are bile insoluble. Next question, hemolysis. Now this hemolysis happens because of the streptolysin S. Streptolysin S is a heat stable, okay, toxin, heat stable, and this is low immunogenic. This is low immunogenic or non-immunogenic rather, you can write. It is not immunogenic, and as the streptolysin O, which is immunogenic and it is heat labile. It is heat labile. That's why anti-streptolysin O azotriter is used for making the diagnosis of acute rheumatic fever. Okay, these are not going to be the answers. Now obviously this test is shown, it is a camp test. Okay, camp test. Okay, camp test for streptococcus agalactiae. Cat, sat and mat, these are not used for now. Okay, mat is for leptospira, you know. Then your sat is for probably brucella, and cat is probably mycoplasma. Okay, these are all your serological tests that you do. Next question is a 5-year-old presents sudden fever and rash. Examination shows febrile state is there, lymph nodes are there, circumoral pallor is there, red lines are there, sandpaper like rash over the trunk and extremities, and strawberry tongue. So many clues are there. So strawberry tongue in a 5-year-old suggests two conditions. One is your Kawasaki disease, another is scarlet fever. The Kawasaki obviously a vasculitis, so and there is no relevant history provided here because in Kawasaki there will be non-purulent conjunctivitis along with there will be reddish swollen limbs. The periphery will be reddish and swollen. Okay, there will be lymph nodes, but that won't be like tender lymph nodes won't be there. Okay, and there will be rash, but that rash will be kind of maculopapular. It's not like sandpaper like rash. Okay, then measles and Rocky Mountain fever are out of question also here. So the answer to this question will be scarlet fever. That is very important. The scarlet fever, it is caused by streptococcus. Okay, many things are given like here red lines in antecubital fossa, that is known as Pastia lines. Okay, this is called Pastia lines. This is called Pastia lines are there, and the hallmark is sandpaper rash. This is the hallmark. Okay, this is the hallmark that you will be getting. Okay, next we are going to see the next question. Here they have asked that a gram positive cattle is negative. So gram positive cattle is negative, chain forming, okay, bacteria is there. Post mitral valve replacement में patient presents with fever and malaise, and then you are getting this thing, diagnosis of infective endocarditis made. What is the most likely causative organism? See, gram positive cattle is negative, so that means it is streptococcus. Okay, now you have and negative for inulin fermentation too. Okay, and there is optocin resistant. So these three differentiates from viridans, and these three differentiates between viridans and pneumococci. So the answer to this question will be viridans group, viridans streptococci. नहीं होगा. Pygens is your beta hemolytic group A streptococci. Agalacti नहीं होगा, it is beta hemolytic group B streptococci. Okay, streptococcus pneumoniae नहीं होगा because it is optocin sensitive, bile soluble, and it is inulin fermented. It ferments inulin, but इसमें आप देख लो. Okay, neither of this mention. Optocin resistant है, Inulin fermentation nahi hai, negative for inulin fermentation, and bile insoluble, so this is not going to be the pneumonia. So it is Streptococcus salivarius, which is a member under the Streptococcus viridans group of streptococci. Okay, which of the following is not a virulent factor for the Neisseria gonorrhoeae? The Neisseria gonorrhoeae, the virulent factor नहीं है. This is Ig protease mediated, yes. Pila type 4 is there, and outer membrane protein containing lipooligosaccharide, which is important. AIM protein is for Streptococcus or Streptococcus pyogenes. The AIM protein is there, and that is why this is causing the molecular mimicry, and because of the molecular mimicry you are getting two complications which are non-suppurative complications of Streptococcus pyogenes. One is your acute rheumatic fever, another is your post-streptococcal glomerulonephritis in childhood. Which of the following is most dreadful complication caused by Neisseria meningitidis? Now they have asked Neisseria meningitidis, and this is no doubt Waterhouse-Friderichsen syndrome. The Fies-Hugh-Curtis syndrome is following your Neisseria gonorrhoeae. It is following Neisseria gonorrhoeae. Okay, and the answer to this question will be Waterhouse-Friderichsen syndrome. The patient will be having severe adrenal hemorrhage and shock. Okay, Neisseria meningitidis, remember it is maltose ferment. It ferments maltose. It is having capsule. Okay, and it is having capsule, and it ferments maltose and glucose. But gonorrhea, it only ferments glucose, not maltose, and it is non-capsulated. Another one, we have vaccine against Neisseria meningitidis, but we don't have any vaccine for against gonorrhea because of the antigenic change. Next, which of the following vaccine is most appropriate in a patient with asplenia? We know asplenic patients will be having, because spleen is responsible for removal of the capsulated organism. Okay, so when there is asplenia, so the defense against the capsulated organism, the encapsulated organism, is lost. So you have to first give the meningococcal conjugate vaccine, and that should contain A, C, Y, and W135 serogroups. Okay, yes, 4 groups के against we have to give meningococcal conjugate vaccine. Yes, we have to give pneumococcal polysaccharide vaccine also, but most appropriate answer will be men. Then they are asking you about which of the following deficiency, complement deficiency, increases the risk of infection from Neisseria, you know, from C5 to C9 complement factor. This deficiency increases the risk, so the answer to this question will be C8. Okay, DAF deficiency, it leads to paroxysmal nocturnal hemoglobinuria. You remember CD55, CD59 उसमें से. Next, which of the following treatment option is basically most appropriate for a patient suffering from Neisseria gonorrhoeae? Okay, I told you Neisseria gonorrhoeae, you need to give third generation cephalosporin, but moreover you need to give azithromycin. Okay, azithromycin, because sometimes what happens, gonorrhea may be associated with chlamydia infection and you have to tackle that, so azithromycin is an important. Diabetic patient insufficiency, renal insufficiency, and UTI. Gram-positive cocci, which is spectacle shaped, surviving in 6.5% initial and resisting 40% bile. Positive PYR test. So this is actually, they are telling you something related to gamma hemolytic streptococci. Related to gamma hemolytic streptococci, that means either it is a enterococcus or it is a non-enterococcus. Okay, enterococci or non-enterococci. Okay, so obviously the answer to this question will be enterococcus species, because baki they are not gamma hemolytic at all. Okay, at staphylo, it is not a strepto. Now, how you know? See, enterococcus species is something which survives on 60%, 6.5% NaCl, and its growth is resisting and surviving in 6.5% NaCl. Enterococci 6.5% NaCl में survive करता है, and very important, it resists at 40% bile. Okay, at 40% bile, and this is positive for PYR test. Pyruvate reductase test is positive. PYR test is positive. Okay, PYR test is also positive for Streptococcus pyogenes. Okay. 65-year colorectal polyp is there, hypertension, presence with fever, chills and fatigue, heart murmur detected, and there is mitral valve vegetation. Okay, gram positive cocci is there, chains mein, so it is Streptococcus. And what is the most likely organism responsible for the disease. So it is streptococci, not staphylococci, because it is in chains. Okay. Now, Streptococcus agalacti, Galolyticus pyogenes, which will be the answer? The answer to this question will be Galolyticus. Okay, because see, there is this mitral valve vegetation, means this is a case of infective endocarditis. Okay, so when there is infective endocarditis, okay, then in a patient who has increased risk of colorectal polyp or increased risk of colorectal cancer, in that case the bacteria which is responsible for this infective endocarditis is what is your Streptococcus galolyticus. Okay, next is, which of the following is most common organism associated with Fournier's gangrene? Fournier's gangrene, most common is your Streptococcus. Okay, though both aerobic and anaerobic, it's a mixed infection. Both aerobic and anaerobic is important. Okay, but most common is Streptococcus. It may be caused by Staphyloproteus pneumococcus also, but the most important is Streptococcus. Okay. Next, another important point that you need to remember is the prosthetic valve endocarditis. Prosthetic valve endocarditis. Okay. Prosthetic valve endocarditis. Remember, the prosthetic valve endocarditis, the single most common organism is Staph aureus. The single most common organism responsible for prosthetic valve endocarditis. Okay, both early as well as late. Both early as well as late is your Staph aureus. Only for the early one is the Staphylococcus, that is coagulase negative Staph aureus. Okay. For the late one, it is the viridans group of Streptococcus. It is the viridans group of Streptococcus. So these are as a group. Okay. Viridans may say the most important is Streptococcus sanguis. So this is important. Prosthetic valve endocarditis, single most organism is Staph aureus, but as a group for early one it is cons, and late prosthetic valve it is viridans group, that is Streptococcus sanguis. Okay. Thank you.